Mouth is parched. Saliva helps prevent tooth decay by limiting the growth of bacteria through the bacteria-producing acid equation. Saliva also improves your ability to taste food and makes it easier to chew and swallow it, and the enzymes in saliva aid digestion. Low saliva and dry mouth can be anything from a minor annoyance to a serious threat to your overall health, the health of your teeth and gums, your appetite, and your ability to enjoy food. Oral dryness can be a symptom of a variety of diseases, including diabetes, sarcoidosis, stress, and anxiety, and mucous membrane dryness can be a side effect of a number of medications, particularly those used to treat hypertension and some mental illnesses. The signs and symptoms of dry mouth. The following are the most common symptoms. Disgusting mouth odor. Lips that are inflamed or cracked. The mouth's mucous membrane or the inner lining of the cheeks and lips has cracked, causing the skin to split into the corners of the mouth or become painful. You have a dry mouth. Dyslexia or a problem with the sense of taste. Thrush is a fungus that causes infections in the mouth. Tongue pain is a common ailment. Increased thirst for fluids, particularly at night. Inflammation of the tongue and ulcers on the tongue. Lipstick gets stuck between the teeth. Gum disease is more common. Increased tooth decay and plaque. Problems in communication. Issues with swallowing and chewing, particularly with dry and brittle foods such as biscuits or medications. Issues with wearing dental appliances, such as dental ulcers and tongue stuckness. Salivitis is a condition in which the mouth is inflamed. Sore throat. Sticky saliva. Third, saliva. Causes and factors of the risk of dry mouth. The most prominent reasons include the following. 1. The side effects of some medications. Oral dryness is one of the common side effects of many prescribed and described drugs, including depression and anxiety treatment medications, allergy treatment medications and colds, such as antihistamines and congestion, obesity-related medications, acne treatment and medications, treatment for epilepsy, medications used to treat high blood pressure, such as diuretics, anti-diarrhea and anti-nausea drugs, medications for urinary tract infections. Some bronchial spoilers, for example, are asthma medications, sedatives and muscle-relaxing medications. 2. The negative consequences of certain diseases and infections. Oral dryness can be one of the side effects of medical conditions, including Sjögren's syndrome is a type of Sjögren's syndrome, human immunodeficiency virus, HIV. Alzheimer's disease is a disease that affects people of all ages. Diabetes. Anemia. Cystic fibrosis is a disease that affects people of all ages. Rheumatoid arthritis is a type of arthritis that affects the joints. Hypertension. Parkinson's disease is a neurological disorder. A stroke of the brain. Mothers. 3. Some medical treatments side effects. Damage to the salivary glands, which secrete saliva, reduces the amount of saliva produced. For example, the damage can be caused by radiation in the head and neck, or by cancer chemotherapy. 4. Nervous system damage. Nerve damage in the head and neck area as a result of injury or surgery can cause dry mouth. Drought. Number 5. Dry mouth can be caused by conditions that cause dehydration, such as fever, excessive sweating, vomiting, diarrhea, blood loss, and burns. 6. Personality. Smoking or chewing tobacco can reduce the amount of saliva you produce and exacerbate dry mouth, as can breathing and having your mouth open wide. Dry mouth complications. If there is not enough saliva and the mouth is dehydrated, this can lead to plaque buildup, tooth decay, and gum disease are all on the rise. Ulcers in the mouth. Infection with yeast in the mouth. Sores or cracks in the corners of the mouth, as well as lip cracking. Malnutrition as a result of chewing and swallowing difficulties. Drying out the mouth. The doctor or dentist may examine the patient's mouth and review their medical history, as well as perform blood tests and X-rays of the salivary glands. The most common diagnostic methods include the following. Measuring by cyelometry. This is a straightforward procedure that involves placing assembly devices over the air duct holes in the saliva glands and stimulating saliva production with citric acid. Celliography is a term that refers to the study of. It is a radial examination of the salivary glands and channels that can help you find stones and masses in your salivary glands. Biopsy. A small sample of salivary glands is taken, as this is commonly used in the diagnosis of the Sjogren syndrome, and a biopsy may be required if the doctor suspects a malignant tumor. Many doctors say that even when a patient complains of severe dry mouth, the oral mucosa appears wet, and that it can also be the other way around, where the mucous membrane of the mouth appears dry but the patient does not complain of dry mouth symptoms. Treatment for dry mouth. The following are some of the treatment options. 1. Stop taking any medications that make your mouth dry. If your doctor believes the drug is to blame, he or she may change your dose or switch you to a drug that does not cause dry mouth. 2. The use of mouth moisturizing products. This can include things like whether you need a prescription or not, saliva that has been synthesized, moisturizers for the mouth, oral lotions for dry mouth, particularly those containing effective xylitol, such as Biopsy, or dry mouthwash that also protects against tooth decay. 3. Other options for dry mouth relief. You can try the following methods to dilute. Chewing gum with no added sugar. Sugar sucking. Ice flakes are being sucked. Drink plenty of water to stay hydrated. During meals, drink plenty of water. Before swallowing, chew thoroughly. Dry, hot, and salty foods should be avoided. Caffeine and alcohol should be avoided. In your bedroom, use a cold air moisturizer. Dry mouth prevention. The following are some of the most common preventative measures. Sucking candy, for example. The most prominent methods of prevention include the following. Chewing sugar-free gum or sucking sugar-free candy. Try to avoid acidic foods like lemon, which can cause teeth to dissolve, and ice chips or sugar-free ice canals can be sucking, but never chewed ice, because it can harm your teeth. These sucking and chewing procedures help stimulate the flow of saliva, but they should not contain sugar to reduce the risk and erosion of tooth decay. Drink a lot of water. To help keep your mouth moisture and reduce mucus, carry water with you to sip it throughout the day and keep the water next to your bed at night. Choose a toothpaste that contains fluoride. Wash your teeth with a toothpaste containing fluoride and use fluoride lotion and visit the dentist regularly. Avoid commercial wash or mouthwashes that contain alcohol or peroxide, as these ingredients will increase your mouth. Eat wet foods. Read foods with broth, soup, sauces, broth, creams, and more than eating soft, cold, or at room temperature. Avoid salty foods and dry foods. The most prominent of these foods includes the following. 1. Biscuit. 2. Toast. 3. Dry bread. 4. Dry meat. 5. Poultry. 6. Fish. 7. Dried fruits and bananas. Avoid alcohol or caffeine drinks, such as coffee, tea and drinks that contain chocolate, as alcohol and caffeine increase the loss of water by causing frequent urination. Other ways. The most prominent other methods include the following. 1. Breathing through the nose and not as much as possible. 2. Use the room evaporation to add moisture to the bedroom air. 3. Use the alternatives to the available medical saliva without a prescription.